So, you've heard what leaky gut is, but you're not really sure how to fix it. Let's solve that. I'm Julie Ann. I'm a nurse practitioner, functional medicine provider, and gut health expert. So, let's talk about leaky gut. Leaky gut is also known as increased intestinal permeability. This is a term to describe a condition in which the lining of the small intestines becomes more porous or leaky. The small intestine's lining is normally acting as a barrier that controls what gets absorbed into the bloodstream and what stays in the digestive tract. When this barrier becomes compromised, it can allow substances that should be confined to the intestines to pass through into the bloodstream. Leaky gut is associated with a large range of health issues, including food sensitivities, autoimmune diseases, digestive issues, and it can also lead to more systemic problems like allergies, skin conditions, and mood disorders. Before we talk more about leaky gut, let's review why gut health is critically important. There are a few reasons that our gut is really central to everything that happens in the body. First, digestion and nutrient absorption. Our digestive system is responsible for breaking down food into nutrients, things like proteins, carbohydrates, and fats. And a healthy gut ensures efficient digestion and absorption of these nutrients, which provides the body with the essential elements needed to function properly. Our immune system. There is a significant portion of the immune system that is located in our gut. A healthy gut helps to regulate the immune system, preventing harmful pathogens from invading the body, while also allowing these beneficial microorganisms to grow and thrive. An imbalanced or a compromised gut can weaken the immune system and increase susceptibility to infection and diseases. Now, mental health. There is emerging research suggesting that there is a strong connection between our gut and our brain. This is known as the gut-brain axis. A healthy gut microbiome can influence our mood, our stress levels, and our cognitive function. Imbalances in the gut can contribute to these mental health disorders, even things like anxiety and depression. A balanced gut microbiome helps to regulate inflammation in the body. Chronic inflammation, we know, is linked to numerous health problems, including autoimmune diseases, cardiovascular disease, and metabolic disorders. A compromised gut barrier can contribute to increased inflammation. Maintaining a healthy weight. The composition of the gut microbes can affect metabolism and weight regulation. An imbalance in the gut microbes can lead to weight gain and obesity. A healthy gut also prevents the development of food sensitivities and intolerances. A compromised gut barrier can allow these undigested food particles to enter the bloodstream, triggering allergic reactions and even autoimmune diseases. The health of our skin is strongly related to the health of our gut. Skin conditions like acne, eczema, and psoriasis have all been found to be influenced by our gut health. And lastly, gut health can influence hormone balance, affecting various body functions, including our menstrual health and our fertility. So now let's review what actually causes leaky gut. First, a diet that is high in processed foods, added sugar, unhealthy fats, and low in fiber can contribute to inflammation and increased permeability. Prolonged or high levels of stress contribute to increased intestinal permeability. Now, stress can influence our gut motility, blood flow, and the gut-brain axis as well. An imbalance in the gut microbiota known as dysbiosis can lead to a disrupted gut lining. The presence of an unhealthy balance of bacteria in the gut may contribute to inflammation and increased permeability. There are some medications, such as non-steroidal anti-inflammatory drugs, also known as NSAIDs, and also antibiotics that can harm the gut lining and contribute to increased permeability. Certain infections and certain medical conditions like inflammatory bowel disease, such as Crohn's or ulcerative colitis, lead to inflammation and damage of the gut lining. Food sensitivities can also contribute to this inflammation and increase that permeability. Alcohol and toxins. Excessive alcohol consumption and also exposure to toxins can damage the gut lining. And finally, genetics may play a role in an individual's susceptibility to gut-related issues, including increased permeability. Now that you know and understand a little bit more about leaky gut, let's talk about how do you know if you might have leaky gut. Here are some of the most common signs and symptoms. First, digestive issues, chronic diarrhea or constipation, bloating, gas, abdominal pain or discomfort, and food sensitivities. Skin issues like acne, eczema, or psoriasis. Autoimmune conditions that cause things like joint pain, muscle aches, fatigue, headaches. Mood and mental health issues, such as anxiety, depression, and brain fog. Systemic symptoms such as malaise, low energy, and generalized inflammation. If any of this resonates with you, you now may be wondering, okay, how do I test for leaky gut? The best test for leaky gut is a test called a zonulin level. Now, zonulin is a protein that is secreted by the intestinal tract and is currently the only known protein that reversibly regulates intestinal permeability by controlling the tight junctions between the epithelial cells. A zonulin level can be checked by stool analysis, which can be ordered through Rupa Health. Let's talk about some ways to heal leaky gut. First, let's talk about nutrition. Eating a balanced diet that is rich in whole and unprocessed food. This should include things like fruits, vegetables, lean protein, whole grains, and healthy fats. Increasing your intake of fiber helps to promote growth of beneficial gut bacteria and improves digestion. Prebiotics are non-digestible fibers that nourish the beneficial bacteria or the probiotics in the gut. Foods that are rich in prebiotics include things like garlic, onions, leeks, asparagus, and bananas. Probiotics are the beneficial bacteria that can help to maintain a healthy gut microbiome. You can find probiotics in foods like yogurt, kefir, sauerkraut, kimchi, foods that are rich in omega-3 fatty acids. These are essential fats that we need to maintain a good, healthy gut lining. You can find omega-3s in foods like salmon, mackerel, flax seeds, walnuts. Staying well hydrated is also extremely important for digestive health. Water helps to promote proper functioning of our digestive system. Avoiding triggers. If you suspect that a certain food is causing or exacerbating your digestive issues, consider an elimination diet to identify and avoid trigger foods. In managing stress, chronic stress can negatively impact our gut health more than you might actually realize. Try engaging in stress reduction techniques like meditation, yoga, or deep breathing exercises. And finally, let's talk about some supplements that are supportive to healing a leaky gut. Probiotic supplements, which contain live beneficial bacteria, can help to maintain that healthy gut microbiome. Prebiotics, again, are non-digestible fibers that nourish the beneficial bacteria. Digestive enzymes. These are supplements that help to break down food and improve nutrient absorption. L-glutamine. L-glutamine is an amino acid used to support the gut lining. It is thought to help with maintaining that integrity of the intestinal barrier. Collagen is a protein. In fact, it's the most abundant protein in the body that helps to maintain a healthy gut lining. Zinc is a mineral that is important for gut health and may be supplemented to help with leaky gut. Licorice root and quercetin, as well as vitamin D, can all be supportive to healing the gut lining and maintaining a good intestinal permeability. If you want more videos on root cause medicine, make sure to like and subscribe to our channel.